Greetings, Patho students, and welcome to week 11 of our pathophysiology class, almost to the end of the line here. Musculoskeletal function. This is unit 12 in your ebook, which is chapters 42, 43, and 44. So listen up, and I'll tell you what to focus on. In chapter 42, which is structure and function of the skeletal system, you'll be happy to know that I want you to focus on just a few things in that chapter. There are many terms in the chapter which relate to the characteristics of the bone itself. Obviously, the main purpose of the skeletal system is to keep us upright and to protect our internal organs. And there is a diagram, or figure 42-1, which differentiates the axial skeleton from the appendicular skeleton. And one is in blue. I believe it's the axial skeleton that you'll find in blue, which is basically the head, the ribs, and the spinal cord, which protect our internal organs and all of our vital organs. Then the rest of the body has to do with our appendages, hence the name appendicular skeleton, which is in white, which are our arms, our pelvis, and our legs, basically. So just take a look at that and be mindful of what those terms mean. And keeping in mind that the other major primary function of bone is to produce our blood cells. Red blood cells, white blood cells, platelets. All of our blood cells have their origin in bone marrow. So keeping that in mind, it's really important for us to maintain proper bone health. And the next section that I want you to read in this chapter has to do with bone growth and bone remodeling. Here you'll read about the osteoclasts, the osteocytes, and the osteoblasts. And take a look at table 42-1 that talk about those three specific bone cells and what their role is in bone resorption and formation. Then there are a couple of other factors that are important in our bone development and our bone health, and one is PTH, parathyroid hormone. If you recall when we talked about the endocrine system, the parathyroids are the little raisin-like glands that really live on top of our thyroid gland, and their main purpose is to regulate our serum calcium levels. Calcium is obviously imperative for bone development and bone growth. So read or remind yourself about the role of parathyroid hormone. Also calcitonin, which is its counterpart. So when we think of PTH as bringing our serum calcium levels up, it is calcitonin that's responsible for bringing our serum calcium levels down when they become too high. And also the role of vitamin D in calcium regulation. So three specific substances here: PTH, parathyroid hormone, calcitonin, and vitamin D. I want you to read about those three and then take a look at table 42-2. That is it for chapter 42. Then moving on to chapter 43, which has to do with disorders of the skeletal system, trauma, infection, neoplasm, and some childhood disorders. Here, I want you to be able to differentiate all the different kinds of injuries that are sustained. Contusion, bruising, hematoma, sprain, strain, dislocation, and subluxation. And all of these terms are kind of together in the top of that chapter. Look at figure 43-1 for some differentiation of the different kinds of sprains that can occur with various injuries. Then there are major classifications or categories of fracture, and they have to do with the location of the fracture along the bone and also the type of the fracture. And you'll find that in figure 43-5 is a nice graphic depiction of various types of fractures. Then there's a wonderful video. I love the videos because they remind us how really magical our body is. And all that's going on while you're sleeping, while you're impervious, you have no idea of what's going on. About bone fracture healing. So how do bones, what is the process of bone healing? And there's a really cool video that will outline that, and it's just about 3.5 minutes. But I do want you to read about the steps in bone healing, be able to discuss, for instance, the factors that affect bone healing. Take a look at table 43-1 for the complications that occur in bone healing. And then in general, there are several complications that can either be fatal in some cases, like fat embolism. Following a fracture, if a fat embolism occurs, travels up to the lungs, that can be a fatal anomaly. And the other is compartment syndrome. Read about compartment syndrome. I don't know that compartment syndrome can end up being fatal, but it can lead to the loss of a limb if it's not addressed. And we used to think of compartment syndrome as happening only in the presence of a cast, when a cast was on a limb and it was too tight as the limb swelled. But now we know that compartment syndrome can occur with or without a cast. So read about compartment syndrome. Then move on to bone infections and osteonecrosis. Bone infections, you can kind of tell, like, okay, that's going to be osteomyelitis, which is an infection in the bone. Osteonecrosis is when the bone tissue is actually dying. So take a look at figure 43-8 related to osteomyelitis. And then 43-9 and chart 43-1 related to the common causes of osteonecrosis. Moving on, we're going to now look at tumors, benign bone tumors and malignant bone tumors, and then another classification, which is metastatic bone disease. So just read specifically about benign, malignant bone tumors, and then metastatic bone disease. So the first two are when there's an actual problem within the bone and the bone tissue. Metastatic bone disease is when there's a primary tumor somewhere else in the body, and over time it metastasizes or moves to the bone, which is a common occurrence in some cancers. Lastly, in this chapter, we'll go on to childhood disorders. The one I want you to pay attention to, the most common, is scoliosis. So read a little bit about scoliosis and look at figure 43-24. Scoliosis is something that nurses, you'll learn in nursing school how to screen for scoliosis. It's usually done in the childhood years, early childhood years. That's it for chapter 43. Moving on to chapter 44, disorders of the skeletal system, metabolic and rheumatoid disorders. So I want you to know the term osteopenia, and then be able to relate osteopenia to osteoporosis. So we have many people, elderly people, that are diagnosed with osteoporosis. And there are risk factors for osteoporosis. Look at chart 44-1. And then I want you to read about the pathophysiology of osteoporosis and why that is such an issue for older adults. And it puts them at risk for falls, and it puts them at risk for what we call mechanical fractures, which is when you're just walking along minding your own business and a bone breaks when you have severe osteoporosis. Also moving on to differentiate what the rheumatoid disorders are, the definition of arthritis, and then later in the chapter you'll read about rheumatoid arthritis versus osteoarthritis. Arthritis is the umbrella, but there's two different causes. So osteoarthritis is one, and rheumatoid arthritis is an autoimmune disorder. So read about RA, rheumatoid arthritis, then systemic lupus erythematosus, which we call lupus, another autoimmune disorder, and then lastly systemic sclerosis or scleroderma, the last of the three autoimmune disorders that I want you to read about: RA, lupus, and scleroderma. And as I said, to be able to differentiate rheumatoid arthritis from osteoarthritis. Take a look at table 44-1 for the clinical features of osteoarthritis. And that is it. That's the only thing I want you to look at in chapter 44. So not a lot of content for you to take a look at, but you're getting ready to take your course exam number 4, which will be next week. Then following will be your final. The final will be comprehensive. So it will be a format similar to all of your other course exams, but the content will be 75 questions spread out over the whole semester, hitting on the most important points. So if you have any questions about this week, chapters on skeletal, the musculoskeletal system, or if you have any questions possibly about your grade and how you're doing, send me an email and I'll get back to you. Have a good week. Thanks.